You're listening to the Move to Value podcast, powered by Chess Health Solutions. The Move to Value podcast is dedicated to helping healthcare providers understand and make the transition into value-based care. We do this through conversations and the sharing of innovative ideas with practitioners, experts, and leaders throughout the healthcare industry. Our mission is to sustainably transform the healthcare experience for the patient, provider, and care team by cultivating a value-oriented, compassionate, and health-aligned community. Today we hear from Kris Shepard, Senior Vice President of Clinical Enterprise Development and Core Market Growth and Physician Partnerships at Advocate Health. In a conversation with Chess President Dr. Yates Lennon, Kris talks of how management services organizations benefit patients and create opportunities for practice growth and professional development for providers.
Well, good morning, Kris. Glad to have you on the Chess Move to Value podcast. Look forward to our conversation today.
Good morning. Yeah, great to be here.
So, Kris, I'm looking at your title, SVP, Clinical Enterprise Development and Core Market Growth, Physician Partnerships. Tell us what you do.
I do a few different things, and as that title probably implies, sometimes I'm working on your plain vanilla physician practice acquisitions. Sometimes I'm working on acquisitions that are not so plain vanilla, more complicated, larger scenarios, something particularly unique. And then I work on a range of other physician partnership transactions, professional services arrangements, as well as working on management services opportunities that we see with groups. And we really view that clinical enterprise development as, broadly designed to look at our physician networks across the advocate enterprise and pursue what we think will work in a given market, a given specialty. And so that's why it's a fun job to have. I get to be creative and engage with people in very different settings and try to put together things that are appropriate in the right context.
Yeah, never a moment of boredom, I would imagine, with that much variety.
Nope.
Well, you touched on managed services. There's a lot going on today with various managed services organizations, as well as what you might call value services organizations. Talk to me a little bit about, sort of at a high level, what do you think the opportunity is in the MSO/VSO, either or both, market today?
Yeah, I think I'll come at it from the perspective of physician groups that we talk to pretty regularly. And, different groups have different needs, but one of the realities that seems to be hitting a lot of, physician-owned practices is that they don't necessarily have the scale to keep up with whether it's, physician practice infrastructure needs or the value-based care capabilities that they need to be successful. And so it's, two different buckets that can be addressed through management services and value services arrangements. But that's the reality. I think practices used to be able to kind of, do just fine on their own. I think there are a variety of factors playing in to the challenges on independent practices now, payer relationships and kind of reimbursement challenges that exist, the cost pressures that are hitting everybody, especially in the healthcare industry, kind of inflationary factors. And then there are things like, EMRs are expensive. It's expensive to fend off cyber attacks, to have the right cybersecurity frameworks in place to make sure that you can continue in operations, to have the best revenue cycle, the best supply chain options. All those are things that are, I think, increasingly challenging, even for the larger physician practices out there. So there's a scale factor there. Same kind of themes with respect to value services. I think it takes a lot. There's analytics platforms, there's teams of people to support a practice in delivering care the right way, and then being able to record that and have that be apparent in quality metrics that get reported and cost metrics and everything else. So I think it's this moment, and from I work for Advocate Health, for a health system, and from our perspective, we need strong physician groups and physician practices, and we've historically had a pluralistic approach to physicians. We have a robust employed medical group. We have some other hybrid arrangements, and then we have loose partnerships with practices that are wholly independent, but still great partners with us on the medical staff, involved in leadership roles and in helping us craft our service line strategies even. Those are important relationships, and we just want to make sure that we have that going forward. It's that robust physician network is important to delivering care, and will continue to be that for the foreseeable future.
Yeah, talk a little bit more, if you will, about just how you see these, the MSO offering, the value service offering, as an opportunity for physician from a leadership perspective. If you're independent physicians today, particularly if you're primary care, tend to be almost completely outpatient, right? I mean, and back in the day when I was coming along, there were no hospitalists, there were no laborists, there were no hospital specialists until later in my career. So, but today I would venture to say the vast majority of independent providers probably rely on hospitalists for their inpatient care. So in the outpatient setting, you tend to be less connected to the hospital, especially for primary care. So how can these MSOs be an opportunity for independent physicians to take on leadership roles and maybe even have a growing connection or role with the health system?
I think the most important way in which our strategies broadly, and certainly an MSO strategy in particular, helps both physicians and their patients is by creating connectivity across different specialties. I think of it less from the standpoint of hospitals or facilities, and more from the standpoint of creating interconnected specialties. And so whether you're a primary care physician or you're a surgeon, having a platform in which you can focus on delivering care and taking care of patients and their needs to be connected to other parts of the system. I think that's an important way in which these MSO services can help. In some ways, it's the center of what we're trying to build. Is ideally, you'd like healthcare to be delivered in a seamless way, and we all go through our own issues personally and watch our family, and it's not always that way. And but I think through these kinds of partnerships, we certainly improve improve our chances of getting to that seamless care.
Yeah, I would agree. I think the most significant result for patients in my mind is the connectivity across the continuum of care, so that everybody can see the patient's journey through the system. I've said this before, I think in other podcasts, but my mom lives in a different part of the state, not here in the triad, but care there is very disconnected. And, The primary care doctor doesn't know what the ophthalmologist has done, doesn't know what the cardiologist has done or said, and trying to bring all that together is a huge challenge. Talk a little bit more, if you will, about just what you see going on in terms of specialist MSOs, if you will. Again, my mind is in value-based care. I tend to just default to primary care, but I think there's going to be a growing need to make sure, as you just talked about, that specialists are connected into the system. So what opportunities are you seeing there? What are the needs you're identifying for specialists and MSOs?
The main need that for specialists that I'm seeing are in that infrastructure support. Everywhere, everything from the EMR system to IT support generally, to rev cycle in particular. I think all those are really important to specialists. Some specialists are very focused on ensuring they have, even if their value play currently is not a huge part of their practice revenue, that they're positioning themselves for value-based care incentives along the way. And the reality is, better than anybody that there are value-based incentives already in place for specialists.
Right.
To your point, we sometimes focus a lot of attention on primary care, but there are important aspects from a specialty standpoint as well. And one of the things I think about this question of what are specialists looking for, there's a challenge from the standpoint of a health system in that there are MSO strategies driven by private equity that have been targeting different specialties, and they've looked at anesthesia and rolled up anesthesia. There's been a lot of focus on ortho. There's an increasing focus on cardiovascular care and so on and so forth. They seem to pick a specialty and drive at it and create an opportunity for physicians to get cash up front, but also join a platform that is kind of takes some of the administrative burden off. Some of those I think are actually really solid platforms. I mean, I talked to some that I think very highly of and thought, I could see that being a partner because they're doing things the right way and not just looking to squeeze every dollar out of the next transaction, but to really focus on taking care of people the right way. But some of them are, a little more mercenary than others.
Yeah, and, true. Yes, true.
Those represent a challenge, I think, from the standpoint of creating the right physician partnerships.
Yeah, from a value lens, if nothing else, and I think there are plenty of models out there for specialists in value-based arrangements, bundles, other opportunities. But if nothing else, from an MSO perspective, it's a network management opportunity where you're able to identify specialists who are high quality, low cost, which is what you want in a value-based construct, right? You want the very best care, but you don't want that transactional mindset that you just referenced, where it's just more and more procedures. Rather, it's the right procedure, right time, right patient, to really help drive success on the value side of the equation. No question. So, what kind of technology? Well, let me back up before I do that. You said something else I wanted to zero in on a little bit. So, what are independent physicians looking for today, and what are the barriers to them being open to the MSO, VSO solution, whether that's private equity or whether that's a healthcare sponsored MSO, VSO.
Let me just address kind of the first part of the question, kind of what are they looking for? I think different practices are coming at it from different angles. Just kind of what I'm hearing is sometimes it's stability. They want to know that they've got a partnership and that with a health system that's bringing them, or a private equity backed MSO that's bringing them some stability to their operations and their practice. I think that's an important factor. Sometimes we hear the legacy theme, that they realize that in order to preserve a legacy, the kind of the practice's history and the practice going forward, that means a very different transaction and relationship and different moment in time for the practice. And that's, it takes a lot, I think, for physicians to get to that. I think there's always kind of how can we improve the economics of the practice is always going to be a big part of the motivations. And I think the other thing that we see is there are a lot of examples of physicians really wanting to be part of building a clinical program and partnering really closely to be able to do that in whatever kind of relationship model exists. And I think that's a big factor. And sometimes there's a realization of if we're not close to the health system, then we could get left behind, and the system might have to build separately in order to execute on a broad strategy. I think some of the barriers are some of it's cultural, and this we see across the advocate footprint in the Carolinas and Georgia and in the Midwest and Illinois and Wisconsin, kind of very different local cultures among the physicians in the market and within the physician network. Some are oriented toward employment. Some are oriented very much away from employment by the health system, and kind of independent practice. And so, in certain settings, like that can even be a barrier to an MSO strategy. Now, part of why we advocate have decided to offer an MSO relationship as one way of being connected is because we realize that some physicians just they'll not get really ever over that hump, and they may still be very important part of the care delivery model in a given community, and that MSO relationship kind of gives them some stability and support while also enabling that connectivity to the health system. I think some of the barriers are economic. There are some practices whose operating platform is going to be cheaper. I mean, you can, I don't want to necessarily call it fly by night, but you can use fly by night, whether it's revenue cycle options and other relationships to help do the basics right and make that work. And for some, that transition to an MSO relationship or a VSO relationship that has a little more meat to it is just going to be an uptick in the cost structure of the practice. And so you have to make sure that in those situations, there's going to be an offset. They're able to grow. There's something there that offsets that added cost. And for some, it's going to be, a lower cost. It's not, I think it's different kind of practice to practice from what we're seeing. I could probably go on barriers and also kind of incentives, but I'll stop there for now.
Well, one of the things you said, I think, in your answer to the first part of the question, you said, I won't get it exactly right, I don't think, but you said something about physicians want to help develop or participate in clinical models, and you said there are a lot of examples. Can you throw out an example or two of what that has been like and how it's worked and benefited, physicians, their patients, maybe even the health system in the process?
Yeah, I'll give you an example of maybe a couple of programs that we've been successful building outside the kind of MSO framework, although they have some elements of it. One is in the greater Charlotte market. We have a service line joint venture called Spine First with an independent neurosurgery group. And what it's allowed us to do is focus with that group, on that spine program for the entire market. And that's the kind of engagement that I think a lot of physicians want to have. They build successful practices. They get known within their specialty and their trade organizations, and I think they naturally want to be part of building a significant clinical presence. And the way I think about that is I think it's possible to build on those kinds of clinical relationships, and some are less formal than a service line joint venture, to build on that with operational connectivity through EMR and other things that is advantageous to everybody. In almost every market that I get to see, there are numerous examples like that of independent physician organizations engaged in programmatic development with the health system, sometimes alongside medical group partners as well. Certainly, one thing to add to that, probably, when you think of physicians becoming employed by our medical groups, I think that that clinical program development is a significant driver for people to want to do that. It reduces barriers to that kind of engagement, and I think allows physicians to feel like they're part of building whatever programs, whether it's cardiovascular, cancer care, et cetera, in a meaningful way.
Right. Well, Kris, thanks. Fascinating conversation. Can you stick around for just a little bit and we'll continue our conversation?
Absolutely.
This is the Move to Value podcast, powered by Chess Health Solutions. We hope you have enjoyed this episode. If you would like more information about this and other episodes, you can head over to movetovaluepodcast.com to check out all of the available resources. If you're interested in continuing to hear about value-based care and how it impacts you, you can sign up for our email notifications or subscribe to this podcast on your favorite podcasting platform. Also, we would love it if you would share the Move to Value podcast across your networks and leave a rating or review. Thanks for listening.